Hi, my name is Stephanie Ramsey, and this is my population health project for Nursing 806, Dr. Smith. All right, what is a sexually transmitted infection, or STI or STD? An STI is an infection passed from one person to another person through sexual contact. An infection is when a bacteria, virus, or parasite enters and grows in or on your body. STIs are also called sexually transmitted diseases, or STDs. Some STDs can be cured while others cannot. This is according to the U.S. Department of Health and Human Services. Common STIs transferred through oral, vaginal, penile, or anal means are gonorrhea, chlamydia, trichomonas, human immunodeficiency virus, syphilis, human papilloma virus, or genital herpes. Sexually transmitted infections in Cleveland County, North Carolina. So if you look at our numbers, and that's the graph on the left, you will see that we are higher than North Carolina and higher than the United States. For Cleveland County, we have 673.8 infections per 100,000 people. If you look at the graph on the right, I have compared us to our adjoining counties, Lincoln County and Rutherford County, which we are also higher than those, and also compared us to one of our sister counties in North Carolina, Lee County. So Lee County has about the same makeup as ethnicity and the environment, it being rural just like us, but still we are falling behind, and we have more sexually transmitted infections than our sister county as well. So STIs in Cleveland County, this is data from 2015 to 2022. For Cleveland County, as you can see, chlamydia took an uptake and peaked in 2021 and is now down in 2022. Gonorrhea took an uptake and then now is also back down. HIV was hanging kind of steady and now is up in 2022. Syphilis was also doing well, not too high numbers, but for some reason peaked in 2022. When you look at these numbers of peaking, you see in 2020, 2021, we had some stuff. We relate that probably to the pandemic, people being inside. So, but now, as you can see, for gonorrhea and chlamydia, we're going down. Unfortunately, HIV and syphilis were going up. All right, trends for Cleveland County with our 2022 data. If you look, you see our highest rates are in January and March, and July and September. Okay, when we're looking at chlamydia. And when we're looking at all these numbers, we're saying, okay, what is going on? So if you think about January, March, you see that falls after Christmas, after New Year's. There's Valentine's Day in there. So you can see why those numbers might be higher than others because people are gathering. We also see in July pretty high numbers, July, August, September. And you think about graduation week, Pride Month takes place then, July 4th. People are out doing more things together, maybe being more intimate. So we've seen those numbers in July, August, September for that reason. Another thing we do see is after the Cleveland County Fair, we see a spike within the clinic within the health department for STDs. So we've noticed that trend ourselves, and we feel like it has to do with the fair. Rates appear lower following some colder months. So if you look at March and April, we know those times are colder, so our numbers are down during that time. October, November, December, our numbers are down a little bit, except for we did have a spike in gonorrhea. Again, that could be because, you've got Thanksgiving in there. Usually people are gathering with their families, but they may be gathering with other people. So over on the right-hand side, when we're looking at populations, I put our race and ethnicity from the 2019 census. You see for Caucasians, white, we're essentially 75% for Cleveland County, and African Americans are sitting close to 21%. And then we have another mix that was bringing in the other ethnic populations. However, if you look at chlamydia, gonorrhea, syphilis, HIV, the African American population is leading with all those STDs. So there's obviously a disparity within the African American population that we need to work on and address. Our ages 10 to 29 accounted for 88.2% of our chlamydia infection and 72.5% of our gonorrhea infection. So obviously another area that needs to be addressed. So our STI community of impact, STIs affect healthcare at every uh, level, whether it's local, it's state, global, national. It's everywhere. If you look at this, you can see that, in 2018, $16 billion was spent on medical costs of STIs. So how does an agency or person decrease these numbers that impact the community? How do we decrease this? So if you look at Beckmer and Rayleigh, which is our book, they noted that STIs can be decreased by educating individuals about STIs. So I think that's something that we need to look at. When you're looking at how much it costs our community, if there's $151 direct costs per diagnosed case of chlamydia, 85 direct costs per diagnosed case of gonorrhea. There's also productivity loss from wages because they got to come into the appointment. They got to come in to get tested. There's multiple factors when you're looking at that for chlamydia and gonorrhea. Okay, the lifetime cost for treatment of syphilis can range from $729 to $1,884, and that's based because syphilis has got phases: primary phase, secondary phase, tertiary phase, and depending on the phase that the syphilis is in, can impact whether they have to have 1 treatment, 2 treatments, 3 treatments. We don't know that till we get their titers back. Okay, so if we take those numbers and extrapolate them out, okay, for chlamydia infection for 2022, if you look at that, it could cost $87,882 to treat our chlamydia cases, $23,035 to treat our gonorrhea cases, anywhere from $31,000 to $81,012 to treat our syphilis cases. So if you add all those up and you look at the total cost, so we're looking anywhere from $142,264 to $191,929. So that's a lot. So when we're looking at our community impact and how is Cleveland County funded for the treatment for our STI infections, we're mainly taxpayer funded at the health department to treat our STIs for prevention, diagnosis, and treatment for our county residents. We also receive grants. Our total for the grants that we receive total $37,983. Obviously, that doesn't take care of the cost that we saw earlier, but it's helping make a difference in the education that we're able to provide for our residents. So when we're looking at our STI infections, we can see that chlamydia and gonorrhea, cause pelvic inflammatory disease, infertility. They can cause lots of problems, especially for gonorrhea in a man. You can see infertility. That cost is not just to treat the STI. If we're seeing infertility in the man from gonorrhea, we're also seeing cost later on to work up the infertility. Also, syphilis can be transferred from mother to child. We can see complications with low birth weight baby, premature deliveries, stillbirth. If born with syphilis and not promptly treated, can lead to cataracts, deafness, all kinds of other problems. Syphilis has many phases that can cause lots of problems, including internal organs that can damage, that can also result in death. So what's being done? The Cleveland County Health Department Education provides STI education to the 8th graders. Our public health department has created a pamphlet that's a roadmap to show you how to get testing and what that entails. We've also distributed seasonal STI posters and flyers placed around multiple Cleveland County facilities, the schools, just multiple places. We hand out condoms free of charge with 10 in a pack, as well as pamphlets on how to use the condoms. We handed them out at the Cleveland County Health Department, physician's office, barber shops, substance abuse prevention centers, and our staff's available to come at any time and talk about STIs. All right, so if we look at the cost of all those things that I just mentioned, that's usually done by a health educator, okay? So that's costing $6,065.20 total for the year, okay? So is it working? Well, look at our chlamydia rates for 2022, they're down. Our gonorrhea rates for 2022 are down. Unfortunately, our syphilis rates are up, and we've got to work on that. We've got to figure out what's going on with that. But our syphilis rates are not up in our 10 to 29-year-old population, so that's a good thing. All right, so these are some of the flyers that we are actually handing out. Don't fall into bad habits. Use a condom, trying to make them catchy so that people are willing to pay attention, okay? Use protection to prevent infection. No glove, no love. Dress them up before you mess them up. So things that can catch people's eye. All right, so the action plan. My objectives are to increase education and awareness within the community. We want to decrease our STIs in our populations that are affected, which is our 10 to 29-year-old and our African American population. Uh, how are we going to do this? We're going to do it through multiple measures: primary prevention and secondary prevention and tertiary prevention. We want to provide education to the school board about STIs in the county. We want to request for the school board to allow the high school nurse practitioners to allow us to provide condoms and dental dams to students if requested by the students. That's been something that's not been allowed. We'd also like to talk to our commissioners and the fair board. I'd like to request that we have a booth set up at the Cleveland County Fair that provides STI information, provides condoms and dental dams if requested, collaborate with the minority coalition to bring STI education to the African American population. Cleveland County Primary Care has a bus to bring STI education, condoms, and dental dams to the African American in the communities within they live so that that can help them. Our secondary prevention is to use the Cleveland County Health Department bus to provide point of care testing for our populations. We can take the bus to the community and community events, take it out to the African American community. It makes it more accessible and timely identification, so which means less transmissibility, less time missed from work. Tertiary prevention, use that bus as well to actually treat the people who were identified at the point of care testing. So when we're looking at evaluation of our program, obviously our goal is to decrease county STI rates, but there's more that we've got to look at from what we tried to implement. Did the school board and the fair board, after we met with them, allow our primary prevention? Did we see a decrease in the STI numbers the year the booth was allowed to be set up at the fair compared to the previous year? Were our 10 to 19-year-old STIs down after condoms and dental dams were allowed to be provided in the high schools? Are the students coming into the nurse practitioner in the clinic and asking for those condoms or dental dams? Those are easy things to track that we can see if they are being utilized. The county maps out STIs by address and can see trends in neighborhoods, apartment complexes, and streets. So we can look and see if these areas that we were concerned about, when we took our bus out there, and we've provided them not only primary prevention from the bus, but secondary and tertiary prevention. Are we not seeing those numbers in those certain areas like we were previously seeing before? Is there less neonates born with STI related complications or, stillbirths? Are there less of those taking place within the county? All that's, public health data that's available. There would be minimal increase in cost to provide these services that we talked about implementing based off what's previously discussed, because we already have nurse practitioners in the county. The bus is there. It's going to be sent out to those areas, so we can put a nurse practitioner on the bus. We can put a nurse on the bus that can do the STI education and treatment for patients. So we would have increase in cost in condom usage because we would be handing out more condoms, but if you can see, there was minimal condom cost because we get those funded pretty inexpensive. Here's a list of my references. Thanks for watching.